Hey everybody, we're here today at White Lotus Integrative Medicine in Toronto, and we're just doing a Facebook Live on PCOS and ovulation as well as fertility. This is Dr. Samina Mita.
Hi everyone.
And we're colleagues here at the clinic. I'm Dr. Fiona McCullough. I'm the author of 8 Steps to Reverse Your PCOS, and we treat a lot of PCOS in our clinic, and it's just something we see every day, and we get so many questions about this topic, so we thought we'd do a Facebook Live on this. Yeah, if you guys have any questions at all, feel free to comment, and we will be able to answer them during this Facebook Live.
Great.
So yeah, just to start off, Dr. Samina, how does PCOS affect fertility?
Yeah, so the biggest thing is ovulation. So oftentimes there's no ovulation happening, or ovulation is late, right?
Yeah.
So that's the biggest thing I would say is that we're trying to help support is ovulation.
Absolutely, yeah. Ovulation is definitely one of the tricky things. It's also really hard actually to tell if you're ovulating with PCOS, right?
Yeah, because oftentimes with LH strips, the strips that you get from the drugstore, that tells you that your luteinizing hormone is elevated and that you're going to ovulate soon. Mm-hmm. With PCOS patients, we have that elevated throughout the whole cycle.
Right.
So, because that's driving testosterone production. So we really want to make sure that, finding a way to really figure out when they're ovulating, and maybe LH strips is not always the best bet.
Right.
Yeah.
So yeah, the strips can be positive all the time.
And what's supposed to happen is the strips are supposed to be positive in the middle of this, or around a certain part of the cycle where ovulation is happening.
Correct. Right.
It should only be positive for a couple days.
That's right. Yeah. And LH is one of the things that causes the high testosterone. So it's really a huge problem. That we see. So we get a lot of people saying, oh, I got those ovulation sticks and it looks like I'm ovulating all the time, or I'm ovulating in this weird, way.
Pattern, yeah.
But it's actually just wrong, right?
It's wrong.
It's wrong. Yeah. So how can you tell if you're ovulating?
Yes, one of the biggest ways you can tell is with cervical discharge or mucus that you have. So usually after your period, it'll end up being dry for a few days, you won't get really anything, and then as the days go on, you'll start to get a white lotion-like discharge. It'll start to build up, and then as estrogen is peaking to get ovulation going, you'll see an egg white consistency. Okay. And that means that you're ovulating.
Awesome.
It's coming,
Yeah, it's definitely the best way that I tell people. Sometimes you'll get the egg white when you're not ovulating, but it's always going to be there when you are, right?
Yes.
So that might cause you to have a little more intercourse at the wrong times, but it's better than missing it.
Yeah, exactly. Yeah, so it's really, some PCOS patients, they don't think they're ovulating, so it's really our job to help them figure it out.
Absolutely. Yeah, we do that all the time. And so what, with respect to ovulation and, what are the different types of treatments that are used to help with ovulation? What are they using in conventional medicine?
Yeah, so oftentimes one of the biggest drugs right now that I've seen being used, and maybe it's different for you, but letrozole is the first line from what I've kind of seen. Letrozole is a drug that can help with ovulation, but also, fertility clinics are also using gonorrhea, which is a little bit more stronger. It's an injectable, so it's a little bit, it's the bigger guns.
Right.
So it's a little bit more intense. So that's why they'll usually start with letrozole.
Right. Cool. And and obviously many people don't want to go down that road, and especially with PCOS, a lot of women can ovulate and they actually are kind of fertile. They just need a little help, So what are the natural treatments that we know help with fertility?
Yeah, so one of the biggest ones that we found is acupuncture, especially in the research. There's a lot of research now on acupuncture and its ability to help promote ovulation, especially using electrostimulation. So we just use an electrode onto the actual needle, and it just stimulates the needle a little bit. And there's points around the abdomen that we use, points around the legs and the arms, And these are all points to help to like bring blood flow to the reproductive organs and just help reduce stress and anxiety, but then also helps to promote ovulation.
That's awesome.
Yeah.
And by the way, like these treatments can be used even if you're not trying to conceive. Like if you're having trouble ovulating, you know, this can be used for that purpose too. So it's not really just for fertility, but you know, for ovulation in general, which is very important.
Yeah.
And what about like, is there any other like natural treatments like herbs that can be helpful?
Yeah, so we use a lot of herbs in our practice, and really because A, they've been used in research to show that it can help with ovulation with PCOS patients, and B, they actually work.
They do. We see it all the time, actually.
Yeah.
Yep.
And so some of the well-known herbs that have been studied with PCOS are things like Simicifuga, racemosa, and that one is really specific because it's a phytoestrogen, so it helps to balance estrogen levels.
I love that.
I know, I love that one. Yeah, black cohosh. Yeah. And it's great because if a patient isn't getting that nice, like, you know, rise in estrogen, right, to establish ovulation, because maybe testosterone is blocking it, then it can be really supportive in a patient like that.
Oh, awesome. Yeah, I find it's amazing. I've been using it for a long time, and I've just found it to be very effective, like better than medications in many cases. So
yeah, they compared it to Clomid in a few studies.
Exactly, right?
It's really cool.
Oh,
and then also,
sorry, yeah, I was going to mention, I think we have a question.
Let's see.
And hey, everyone who's watching, where are you guys all from? We're up here in Canada. If you want to type where you're from, that'd be awesome. I'm always interested to see where everyone's watching us from. So we have a nice question here from Jamie, which is actually a really good question that I get a lot about, you know, some of these fertility drugs. So obviously in PCOS, the egg quality is really important. And we often get the question, do these drugs help with the egg quality or the size of the egg? So Jamie's asked, does Femara help with egg quality or the size of the egg? She's ovulating on her own, but her gyno has recommended the Femara anyway.
Yeah.
So what would you say to that?
I mean, I would say that not necessarily. What would you say?
Yeah, I agree.
Yeah.
Not really. Yeah, so basically the way it seems to work is by, you know, tricking your brain into thinking there's low estrogen.
Yeah.
And then, you know, the estrogen levels will, you know, push back up and you'll release an egg. And so typically what that is it just helps you ovulate a little bit earlier, but the quality of the eggs, so we know that eggs go through about a 3-month window of development before you can get, you know, ovulate. So this is something that they're using just for a few days. I really can't impact the overall egg quality. So things like inositol and, you know, some of our other supplements that help with egg quality, we usually like you to be on those for several months. So they really don't help with egg quality, these medications, but they more stimulate or trigger ovulation. Oh, it's so cool. So we got some people here. We got Scotland. That's so awesome. My parents are from Scotland, so Akai to you. And New Mexico. And so it's great to have you guys here. We have another question from Renee. She was pregnant in 2009 with an ectopic pregnancy and lost one of her tubes. And the other one, they had to cut. Can she still have a baby? And I'm so sorry to hear about that, for your loss. Did you want to answer that, Dr. Smina?
Yeah, I mean, I guess where did they cut it is the question. And
yeah, so when so this is actually, if both of your tubes are cut, which we're not really 100% sure if both tubes, like if one tube was removed and the other one was also fully cut, if that's the case, that's really the best thing for IVF. You know, that's really what IVF is you know, designed for, is to bypass the tubes. So you can, but you would typically need IVF if you have, you know, bilateral tubes.
Yeah. Because if she had one tube, then it's possible.
Exactly. Yeah.
I've seen patients get pregnant with one tube, but yeah, definitely. If both tubes aren't there, then yeah, there's IVF for sure.
Absolutely. Yeah. So, and what about hormones, like natural hormones? Can you tell us a bit about that?
Yeah, we've been talking a lot about progesterone in the practice, and you know, oftentimes PCOS patients have low excuse me, amount of progesterone. And so we've been prescribing it a lot to our PCOS patients to really help promote ovulation. And it can be really successful in some of these patients, just to even regulate your cycle, promote ovulation, and just get help with a healthy pregnancy too, to help prevent miscarriages.
Yeah, absolutely. And it's definitely one of the causes of miscarriage in PCOS is low progesterone. It's so preventable. And we actually use it all the time, and we see patients, getting pregnant and, having better cycles and more regular cycles, because they're just an overall lower amount of progesterone across the board for most women with PCOS.
Right.
Yeah.
So it's really successful to use it.
Yeah. We use it in lots of different ways. I've been following the work of a doctor called Jerry Lynn Pryor for a long time, who has done a huge amount of work on progesterone, and so I really have been finding clinically it makes such a huge difference for fertility, but also for patients with PCOS in general. So
that's great.
That's awesome. And we have another question from Shruti Shah. She's saying, I have PCOS and hypothyroid. I feel hungry even if I have just eaten. And I don't want to take metformin, so what should I do? So hungry all the time. I don't know if you've been to our blog. If you go to whitelotusclinic.ca, if you search PCOS hungry in the search bar, we actually have an article on that.
Yeah, that's great.
So it talks about something called leptin resistance, and leptin regulates our appetite in the brain. And so with the leptin levels that are excessively high, as we see in PCOS, it makes you feel hungry all the time. So it all comes back to insulin resistance. So the insulin resistance in PCOS is quite, strong. And if you test it properly, we also have an article on that you can check out, how to test for insulin resistance. That is huge, and if you bring the insulin down, the leptin also goes down. They're like partners. So really focus on getting the insulin down. There's lots of tips in my book on that. I also have the Eating for PCOS meal plan, but if you check out the website whitelotusclinic.ca, you'll find lots of information on this. But one of the key things that we suggest a lot is inositol, which is often similar to metformin. We love it. We think it's better, I think. What do you think?
I mean, there's been studies that compare metformin to inositol, and it shows that it's like similar and even better.
Exactly. Yeah, it's so awesome. So that's a supplement. And then the other thing, a lot of people aren't eating enough protein and healthy fat. They're eating just a little bit too many carbs with their meal. And so it's really just making sure you're getting like nuts and seeds, avocados, and getting that healthy fat in with every single meal, and making sure that your meals are, really well structured. You've got lots of vegetables, lots of fiber in there, and then just keeping the carbs from overwhelming the meal. Sometimes, we'll eat more carbs than we should in the meal.
Yeah, because then it's going to take a longer time or slower time to digest if you have that protein and fats in the meal versus a carbohydrate, which will just spike your blood glucose, and then you'll want to eat more to compensate for that.
Exactly. Yeah. So these are all like tips that you can do, but if you check out our website, we got lots of info for you there. And then what about fertility and like the prognosis for PCOS, Dr. Samina? Like, what do you, is it, a really difficult situation? Like, what's the overview there?
I mean, honestly, from what we've seen, that, diet and lifestyle can really make a significant impact. And I would say the prognosis is really good in terms of like getting patients pregnant with, even just a few supplements and some herbs and some diet and lifestyle changes.
I know. I agree. Like, when I have a patient with PCOS who has a fertility condition, I'm like, great, we'll fix that. Not too worried. So there's so much you can do. The thing with PCOS is it's very much a condition you can influence with lifestyle, right? So
I find that when we get a diagnosis of PCOS and infertility, it can seem like it's the end of the world.
Yeah,
right? Like
it really does.
your only options are drugs,
Mm-hmm.
and that's not the case. That's definitely not the case.
It's not. Yeah, we have patients every day, not needing to do any of those types of treatments. So yeah, there's tons and tons of hope.
Yes.
Well, I just wanted to thank you guys all so much for joining us today. And Dr. Samina, you can follow her page. She's at Dr. Samina Mitha. And our clinic is at White Lotus Clinic. And we also have an Instagram account if you'd like to follow us. We're always sharing lots of information on health, fertility, and hormones.
Yeah, and if you guys have any questions, just pop them into the comments later too, and then we'll try our best to answer them.
Yeah, absolutely.
Yeah.
Have a great weekend, guys.
Bye.
Take care.